Welcome to the Counselor Soapbox video channel. Today's episode, Drug Education Part 1. What is a drug? For our purposes, we're going to define a drug as a chemical or mixture of chemicals that's required to maintain health, but which alters functioning or structure. We're going to exclude food from that definition. I know there's been a lot of information on the internet lately about the nutritional benefits, additives, and the role of ingredients such as sugar, but we're going to leave that topic to the nutritionists. When we say drugs, most people think of street drugs, illegal drugs, but recently we've seen a lot of overdose deaths as a result of use and abuse of prescription medications. We also see a lot of medical problems and drug overdoses as a result of mixing multiple substances. For this series, we will include alcohol, marijuana, prescription medications, over-the-counter drugs, herbal remedies, home remedies, and the new emerging category of synthetic. There are many ways in which drugs can be classified, depending on the reason you're classifying drugs. Not all of these systems have proved useful to people who are working as drug counselors or to people in recovery. There are a number of ways in which drugs can be classified, depending on your purpose for classifying them. Not all of these have proved useful to people in drug recovery or counselors working with them. Some of the ways we can classify the drugs are by origin. Do they come from plants or are they synthetic chemicals? We've found that chemicals discovered in plants can often be easily synthesized in the lab, blurring that distinction. We can also classify drugs by their principal use. Are they pain meds? Are they blood pressure meds? And so on. Some scientists classify drugs by site of action or by chemical formula or structure. Drugs can also be classified by mechanism of action or by their street names. Street names also usually reflect the effect that the drug has on the user or abuser. In the drug counseling field, drugs are commonly classified into three groups: uppers, stimulants; downers, depressants; and a miscellaneous group of chemicals which alter perception, sometimes referred to as all-arounders. The primary uppers, stimulants, are cocaine, amphetamine, which includes methamphetamine, and caffeine. All of these have had either a medical use and/or a dietary use, but are also used in excess and abused. The downers, or depressant drugs, include opiates, alcohol, barbiturates, and benzodiazepines. These include related chemicals, also commonly known as sleeping pills or tranquilizers. The all-arounders, or drugs which distort and alter perception, include such things as marijuana, PCP, LSD, inhalants, deliriants, and synthetic drugs. There are a couple of noteworthy exceptions to this three-category system. Nicotine sometimes acts as a stimulant and sometimes acts as a depressant. We'll look at this more in a future video. Ecstasy, MDMA, and some related synthetics have properties of both stimulant drugs and hallucinogens or perception-altering chemicals. What's ahead for the Counselor Soapbox video channel? More learning about alcohol videos, more drug education videos, and some mental health and wellness videos. If you've enjoyed this video, please click the like button directly below and subscribe to receive new videos as they are completed. For more information, please visit the Counselorssoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.